This week's Ask Dr. Durie is about bone pain and the question of possible new bone damage. So the question is, if I'm having bone pain, how should I check to find out if this is indicating new myeloma bone disease? What kind of scanning should be done? Well, the first thing to say is that any kind of imaging can be used. X-rays can be used, CT scanning can be used, MRI or PET scanning. The first key point is that if you want to know if there is something new, you must have taken that same type of scan before. If you do an MRI and you find some changes, you must be able to compare and say, okay, was that MRI lesion there before? Otherwise, you don't know if it's new or not. And so you can see right away it is very important to have a strategy for ongoing imaging to assess possible bone damage. Now, which of the different imaging techniques can provide value? Well, X-rays can be valuable in that if you find something new on X-ray, this is certainly something important. If you want to look in a more sensitive way, CT scanning is much more sensitive, and CT of a site of pain can be extremely helpful. Whole body low dose CT scanning can assess the whole body to see if there are any new bone lesions emerging. Now, in a more sensitive way, both MRI and PET scanning can be used and compared over time. MRI is helpful particularly in the spine and brain areas, and this can be often quite important. For PET scanning, whole body PET scanning is extremely helpful to see if there are any new areas of active disease. There is also the opposite value in PET scanning, which is that if the PET scan has been positive and then becomes negative, this is a very excellent indicator of response. And so you can see that different imaging techniques have different aspects which are valuable. But the overriding point to make and emphasize for patients with myeloma is do talk to your doctor and set up a strategy to assess the imaging in your particular case. And this is influenced by what machinery might be available, what scanners they happen to have at the hospital, and also what is the reimbursement and insurance situation for your case. The main thing is that you need to be able to repeat the MRI or the PET CT or whatever is being used on a regular basis to monitor your disease. So for example, set up for re-imaging like once a year. Have a once a year checkup where you can make sure is anything changing. And then if you get that sudden pain or question of pain which is lingering, you are in a very good position to find out, is this something new or is this just some arthritis or some other thing that will pass over a few days or a few weeks? And so this is a very important question and very important for every patient with myeloma to be in a position to accurately know, is this new bone pain important? Is it something that will pass? Is it something that we must look at seriously and consider further testing? So thank you for this question, and thank you for the chance to give this broad information for myeloma patients overall.